Health Awareness Month, and the pandemic has taken its toll on our nation's healthcare workers.
A recent study finds that the levels of distress felt by doctors, nurses, and other healthcare workers over the past few years was similar to what's seen in soldiers who served in combat zones. Imagine that. Our Justin Andrews spoke with one Bay Area nurse who shared her experience with you as well.
Yeah, it's undeniable that nurses and doctors and other healthcare professionals have been stepping up to fight these deadly diseases for decades. When COVID came, being on the front lines may not have seemed any differently, but it was. This morning, a nurse is telling her story about the emotional uneasiness they call moral injury and distress.
I come from a long line of care workers.
Hospitals for Santua Boykin has always left her curious.
Anytime I walked in one, I was like, what is happening here? And
She's been an RN for almost 10 years, but been in healthcare for close to 2 decades. Caring for patients is a passion.
Being born in this particular body, Black and a woman, I know what it's like to be invisible. I take pride in being that person that sees my patient, like in their totality, not just what's ailing them at this time.
Boykin, an ER nurse, was working the front lines when COVID clamped the country. At the time, she didn't realize it also clamped her mind.
I had moments where I had to just go find a corner and cry because I was like, I don't know if I can go home.
As a nurse, she watched dozens of patients die alone without their loved ones by their side because hospitals barred visitors. She was constantly terrified that she too would get sick and infect her family. Studies find that all produces trauma and other mental health issues. For some, hospitals were ground zero.
The mental strain was just like the uncertainty of what was going to happen. And I think that our hospitals did not do enough to create a safety net.
It wasn't until after the pandemic, Boykin realized she needed a therapist, and now boldly feels counselors should have been in the hospital with the nurses during the dark days of the deadly virus.
Your actual life is in danger.
So often factors that were just mentioned in my story there potentially prevented nurses from prioritizing their own self-care. Boykin is an RN at UC Davis. She says in all hospitals, she would like to see better resources to help them support their mental health as they are still providing us care. Lynn.